and clinics in San Antonio. Kissy earned her master's degree in marriage and family therapy from Texas A&M University and master's in social worker from Texas State University, obtaining licensee through the state of Texas as a licensed professional counselor and licensed social worker. Kissy was recently one of the 12 finalists for National Peer Support Peer Specialist of the Year and was selected Peer Support Specialist of the Year for the VA Texas region. Congratulations, Kissy. Our presentation will now be led by Dr. Betsy Davis. Dr. Davis is a psychologist and a local recovery coordinator at the South Texas Veteran Healthcare System. In this role, she promotes veteran-centered approaches to care throughout the local VA system and build community partnership to collaboratively meet veterans' mental health needs. Dr. Davis holds a Ph.D. in clinical community psychology from the University of South Carolina and has a passion for helping individuals with serious mental illness work towards recovery and meaningful lives in their communities. Dr. Betsy Davis.
Thank you, Verna. I'm so glad to see everyone on here. Can everyone hear me? Okay, great. So I am thrilled to be here talking with y'all some about veterans' mental health and services that we're able to offer at the VA, as well as highlight peer support as a critical part of the services that we provide. Let me get my presentation up and running. Okay. So I'm not able to see the chat box. So if someone, maybe Melanie, can kind of monitor that for me and just
Sure.
chime in if there are any questions that come up, I'm happy to take those as we go. So as Verna said, I'm a psychologist with the VA and my title is Local Recovery Coordinator. I think I've talked with y'all a couple times in the past about different services that we're able to offer, but I know it's always a new audience. What I like about what the email that NAMI sent out is even if you're not a veteran directly, you know, we are Military City USA, and so we all have neighbors, friends, family who have served and who are likely eligible for VA services. And so, you know, all of this information is helpful because you never know whenever you're going to encounter a veteran who might need these services. So I want to start out just by talking a little bit about the approach that the VA uses in terms of how we structure all of our mental health services and substance use services as well. So the foundation of all of our services is the recovery model, which I'm sure a lot of y'all are familiar with. This basically says that recovery from mental health and substance use is possible and that treatment can be an important part of that for everyone. But we want to go beyond just looking at symptoms. We want to go beyond just medication, and we want to look at, you know, what is this person's goals and how can we help them reach that? We want to take into account this person's preferences and their values and what's worked for them in the past and cultural factors and looking at trauma and looking at their strengths. All of these things kind of are the foundation for the services that we provide. Making sure that our veterans are an equal partner in their care so that they are able to make decisions about what is best for them in collaboration with providers. The other kind of foundation to our services is having everything be based in evidence and research. So a lot of the services that we provide are evidence-based protocols, especially trauma-focused care like cognitive processing therapy or prolonged exposure. But in addition to that, we tend to also focus on episodes of care, which is basically research has told us that for most people, you get the most benefit from therapy in the first set of like 12 to 16 sessions. Like the first 3 to 4 months that you're in therapy, if you're able to go weekly, you really see a lot of good gains in being able to build those skills. And then after that, a lot of people benefit, but it kind of slows off. And so we get, the VA wants to focus our efforts in where we have the most kind of bang for our buck, in making sure that veterans are able to be seen consistently for 3 to 4 months. And then if they're ready to move on at that point, we can refer to other support mechanisms like peer support, like the NAMI support groups, like other resources that we have, both within the VA and externally. So that's what we call the episode of care model. And then if down the line, a veteran needs another episode of care, they're welcome to come back and get in for that as well. The third component of how our services are structured are interdisciplinary teams. And so this is pretty much across the board. We work very closely with prescribers, counselors, nurses, peer support specialists, vocational rehab specialists, occupational therapists, social workers. Pretty much every single team that we have at the VA is a very comprehensive interdisciplinary team. So a lot of my talk today is going to focus on trying to demystify the VA mental health system and how you get connected and what we have to offer. Because I think sometimes it gets presented as one thing when actually it's a whole host of different programs that will hopefully be able to, veterans will be able to kind of plug in and find the right level of care that's best for them. So I'm going to start at kind of a 10,000 foot view, and then I'm going to go into a little bit more detail about some of the services that we offer. So the first question that we always get is a veteran eligible for VA services? And there's a lot of myths about that. So a lot of times we hear, well, I wasn't a combat veteran, or I'm not service connected, or X, Y, and Z. I didn't retire from the military, so I'm not eligible for VA services. And that is not always necessarily true. So there's a lot of different eligibility criteria. So veterans who are service connected, but also we have some non-service connected veterans, as long as they meet other criteria like income. So I have the line there that I usually refer veterans to the telephone number for the eligibility and enrollment office. And as of a couple of years ago, actually, individuals with other than honorable discharges are also eligible for a certain phase of mental health care as well. So it's not only, veterans with honorable discharges or general. So I always encourage veterans to go ahead and call that number and get a sense that eligibility criteria is always changing, get a sense of what they're eligible for, and go ahead and enroll. You never know when you might need VA services down the line if you're eligible for it. The next step after you're enrolled is to get set up with a VA primary care provider for most people. So I have the phone numbers here for setting up an initial appointment, as well as if you had seen a primary care provider in the past like 3 years, but you just need a follow-up appointment scheduled with them, you can call that second number, which is the central scheduling line. What's nice about the VA is that there's a direct link between primary care and mental health. I'll talk a little bit more about that, but it's called primary care mental health integration. And in most cases, veterans who are at their primary care appointment can meet with mental health that same day and do a brief 30-minute intake, get a sense of what's going on, and then get connected to services. So this is kind of the pipeline for most veterans to get connected to mental health. And then once the veteran is connected to mental health, is assigned to a mental health provider, that person, they'll be designated one person who's their mental health treatment coordinator, and that person will then be able to coordinate all the referrals to different programs. I also wanted to highlight that we have same-day services in both primary care and mental health, which doesn't necessarily mean that you'll be able to meet with your provider, but it means that a veteran with a need for care right away will have it addressed that same day, or if after hours, by the next day. So this is for situations where you can't quite wait till your appointment, but it's not quite an emergency to go to the ER. So keep that in mind as well. Any questions so far? All right, here's the information about all of our clinic locations. We have some that are in flux right now as we're shifting back from telehealth to more in-person care as it's gradually reopening. We have a clinic that's a behavioral health clinic that's opening at the Balcones Heights clinic location, where we've had some primary care clinics in the past. So we'll still have the primary care clinics, but we're just opening up some mental health clinics there too, and that's at the Wonderland Mall down there. So this is just some information that's easy to reference. This is all on the VA website as well, but sometimes it's helpful to kind of have it in this format. So I want to talk a little bit about telemental health services before I go into the specific programs that we have, because as the VA, has responded to COVID-19 back in March, our VA locally was actually one of the first to quickly shift to just about 100% tele-mental health services. And so we have done a great job at being able to transfer all of those individual and group therapy appointments to either telehealth, which I'll talk about in a second, or to phone appointments. And veterans often say that they actually prefer this because they don't have to deal with traffic and parking and the stress of, going to the VA and finding where to go and all of that. You just click on a link. So we're actually going to be continuing a lot of these telemental health services, even once we start to also resume face-to-face services in the coming months. So this is actually going to allow us to expand our staff and to expand our availability for services as well, because we're not going to be as limited by space. So we're excited about that. So what the VA telemental health services looks like is that we use a telemental health software that's specifically developed by the VA. It's very secure. And it's called VA Video Connect. And so all you have to do is have a smartphone, a tablet, or a computer that has a camera and a mic, and you need to have an email address. And with all of that, if you have one of those things and an email address, you'll get an email, and all you need to do is click on the link at the time of your appointment, and you open it up and you're in the chat room with your provider. If you have an iPad or an iPhone, an Apple product, you have to download the free VA Video Connect app. But if not, you just click on the link. Of course, telephone services are available as a backup option, but I have to say that there's something about that video that really makes a difference in my experience just providing services over the last 6 months. So we'll continue to have telehealth as an option. And I don't have a hard update in terms of resuming face-to-face services, but all I can say is over the coming months, we'll be doing more and more of that, especially for those veterans who don't have access to telemental health services. We want to make sure that they have that kind of face-to-face care in a safe environment first. So still going to at the 10,000 foot view, this is our continuum of care. So we have primary care mental health integration, as I mentioned, and then our next level of care is general mental health, which we call the behavioral health interdisciplinary program. From there, kind of a more specialty level of mental health, we have a variety of programs for PTSD, for serious mental illness, for substance abuse, for neuropsych testing, all kinds of things. And then of course, when it's needed, we also have emergency services and an inpatient unit at the Audie Murphy Hospital. All of the first 3 levels of care have been operating largely through telehealth, but the emergency department and the inpatient unit has been open for services for inpatient, face-to-face services this whole time, and will continue to be. Any questions before I go on? See, there's some.
We did have one question posted from the audience.
Sure.
Is related to family members. So maybe this is something you're covering later in your topic, but it has to do with what is being done to help family members, such as spouses or children, with their mental health. I'm sure you're aware that we are hearing how family members of veterans are greatly impacted by the care they are getting or not receiving. What can be done for dependents to advocate for the care for their veterans?
Absolutely. So I will touch on that a little bit towards the end. I'll give a quick answer now that the VA doesn't provide, in most cases, doesn't provide direct care to family members. But we work very closely with our counterparts, including the Vet Center, which I'll talk about and Ray will talk about in a little bit, the Cohen Clinic, Ecumenical Center, Crosspoint, lots of different, as well as NAMI, lots of different community partners that are able to support family members. And then I'll also touch on a resource towards the end for caregivers, as well as for family members who are worried about a veteran and want support in getting that veteran into care. So hold tight on that, and hopefully I'll answer it towards the end.
Great. Also, I think Verna Lister, she's going to be sharing some very new program information through NAMI that is specifically dedicated to veteran families.
Yes, awesome. Thank you for pointing that out too. Okay, so I'm just going to go into a little bit more detail, and then I'm going to hand it over to peer support. For some reason, oh, there we go. Okay, so I mentioned primary care mental health integration. These are the mental health providers who are embedded in the primary care clinics. So in most cases, a veteran can literally walk down the hall or click on another link and be sent to a same-day appointment to that PCMHI provider. That provider can either meet with the veteran for a couple sessions if they just need some stress management skills or some help sleeping or managing chronic pain, or they can also refer to mental health services. The next level of care is the Behavioral Health Interdisciplinary Program, or BHIP. This is our general outpatient mental health clinic. And we have BHIP teams at lots of different locations, including Audie Murphy, Frank Tejeda, North Central, the South Bear Clinic, Kerrville, and Victoria. And the Audie Murphy team will be moving to the Wonderland Mall. So this team is made up of a prescriber, either a psychiatrist or a nurse practitioner or a pharmacist, a couple therapists, either a psychologist or a clinical social worker or a counselor, and a nurse. We strive to kind of incorporate the veteran and their family in these services as well. So they can do medication management, they can do individual and groups therapy, they can also do couples therapy. The main way to get a referral to this program is from primary care or PCMHI. Although if you don't have a VA primary care provider, you can still get a referral to this program, usually by calling one of the clinics and asking for a referral about that. So I also mentioned that we have a whole host of the specialty mental health programs. So we have a clinic that's just devoted to PTSD, for those evidence-based treatments for PTSD. We also have residential and outpatient programs for substance abuse. We have an intensive outpatient program for mental health, and we are working on getting an intensive outpatient for substance use as well off the ground. We have a number of services specifically for veterans with serious mental illness, which the VA defines as either bipolar disorder or some kind of disorder with psychosis. So schizophrenia, schizoaffective disorder, depression with psychosis. So we have a group-based program called Stepping Stones, where veterans are able to kind of attend group therapy throughout the week based on what their preferences are and learn those skills to kind of get back into the community. We have an intensive community mental health recovery program, which is based on the assertive community treatment model, where social workers and nurses and psychologists actually visit veterans in their homes every week to support them in their recovery. And then we also have a psychiatry clinic that's specifically devoted to serious mental illness. We have programs for homeless veterans, including a domiciliary. I don't know the status on that. I think that the residential program might just be open for the substance use side right now, just as they're reopening from the COVID-19 closure. We also have vocational rehabilitation, so supported employment programs help for veterans to get jobs, as well as neuropsych testing. And then the final level of care that I wanted to talk in a little bit more detail about is the emergency department in the inpatient mental health unit. So obviously this is 24/7 access through the Audie Murphy VA emergency department. And the inpatient unit is generally seen as a kind of a short-term stabilization unit. So we try to get veterans through the crisis, whatever they're experiencing, and then set up with outpatient care. So I want to say that the average length of stay on the inpatient unit is somewhere around 4 to 7 days, something like that. We really strive to have a recovery focus down there on the inpatient unit as well, and it's very interdisciplinary. Any questions before I hand this over to peer support? Okay, so Kizzy, are you on?
Yes, can you hear me?
Yes, I can. And I'll go through your slides just let me know when to advance.
So my name is Kizzy Griffin. I'm the peer support supervisor. I have Michael Collins, which is one of my super peer support specialists on the line with me. He'll be presenting a little bit for me. You can hear I'm a little under the weather. So he'll be chiming in and out as we go through the slides. First thing I want you guys to know is that this is what our staff looks like at the VA Center. Our medical center is, we have peer supports in all of our clinics, and we are recruiting for more as we go. We have a structured program here at South Texas. So we will have a supervisor, a lead, and then we have the specialists that we all work together within our group to make sure that peer support is delivered throughout all of our interdisciplinary teams. Next slide. So again, one of our VHA peer specialists, we are very unique because all of us are veterans and all of us have gone through some kind of recovery process, whether it's substance use, whether it's mental health, whether it's both, but we've all had our own journey. And with going through our journey, we are incorporated into our interdisciplinary teams to instill that hope and help with that recovery process and walk through the system of peer support with our providers. So we're in an interdisciplinary team with our providers, and we are one team, one fight, basically. We literally work together to make sure that the veterans have everything they need within the programs and be able to follow the veterans as they exit the programs, just in case they do have to come back into the system, to give them that outlet or that direct contact within the system. We do that because I don't know about a lot of you guys, but a lot of our recovery stories are unique to our own. But we utilize parts of our recovery story. We don't want to tell everything because we don't want to re-traumatize or re-hurt. We have the same code of ethic as do no harm as our providers. So with utilizing our stories and our strengths, we use those life stories to be able to direct our veterans through their recovery process. And again, we work hand in hand with our providers. So we give providers that outlook of the veterans as well. As like, hey, I know that this may work, but hey, let's try this, because for this veteran, it's not going to work, and this is why. So being able to have that direct dialogue, it designs that path that our veterans need within our recovery process. Next slide. So in our recovery components, same thing, we instill hope, respect. We do a lot of strength-based directional tools with our veterans. One thing is, I don't know what my veterans need unless they tell me. So individualized care is a must within peer support, especially within the VA. We have to give that empowerment. Your voice is your voice. Your voice is the only way you're going to be able to step out on your own path and make your own stories. And so that's why we follow the recovery wheel, just like mental health. We just connect the peer support dynamics into each element to make sure we're there to be able to assist our teams and our veterans. Next slide. So Mike's gonna cover this slide for me, just because there's a lot of do's and don'ts, but there's also, we just have to be able to direct ourselves within our roles within peer support. So Mike, are you there?
I am. Good morning, everyone, or good afternoon, or whatever time it is. So as Kizzy was saying, there were some things, there's some roles for our peer providers, and these guidelines that we have listed here are absolutely strict, and are not to be walked on the line between what we can and cannot do. The things that we do with peer support, we facilitate peer support groups. We share relevant our own recovery stories as a way of connecting with our veterans and patients. We advocate for veteran consumers, act as role models for recovery, lead by example. We provide crisis support, communicate with the clinical staff. That's both BHIP and PCMHI. It's imperative that we stay in contact with the providers because at the end of the day, we're doing what's best for the veteran. And we don't want to go against whatever treatment plan the provider may have for them. And we want to help coach them along in that recovery process. We act as a liaison between staff and veterans. We belong to the multidisciplinary teams. We provide outreach education to the VA facility staff and the veterans about what we do in peer support. This is the strongest that our program has ever been. And that is 100% due to Kizzy, what she's done with our team, and people like Dr. Davis, who have been a strong supporter of what we do and pushing us out there to be more relevant within the VA community. Things that we don't do are provide psychotherapy. Psychoeducation, yes. Psychotherapy, no. We don't do other people's jobs. We fulfill the other roles in the facilities. We do what we are there to do, and above and beyond is great, but not other people's job. Collude with veteran consumers against the clinical staff. We don't cross boundaries. We touched on that. We don't support veteran consumers in their self-destructive and illegal behavior. And I might have missed one. And criticize clinical staff in front of the veteran consumer. Those are all negatives. Any questions before? I'm sorry, kids, go ahead.
And this is because we are, like, literally, we are here as a team, and within that team, like going into this next slide of peer, the next slide, Dr. Davis. Within our peer growth placement, is because we have to be able to have a referral process. We have to have that dialogue with our veterans as well as our providers. Now, there's things that veterans are going to tell us that we can say, hey, we can summarize to be able to give to our providers. So with us giving of those summaries, we're not telling verbatim, because there's things that some veterans tell us, because we're veterans and we've been there. We can say, hey, we can give them that push to say, maybe you need to talk to your provider. If that medication doesn't work, don't stop completely. See if there's any alternatives. And then we can give a summary to the providers and say, hey, veteran is concerned the way the medication is making them feel, may need to touch on, different applications, but we won't say, well, hey, they just said that they're just not going to take it. They might tell us that, but we're not going to tell the providers, oh, hey, they just said they're not going to take it. We'll try to address the concerns, use that, like, why won't you? Those open-ended questions of like, why you don't want to take this medication, or how we can go through trying to get that with the providers so that they can get that synopsis of the information to be like, okay, this is what I need to do next time when we're in clinic. Maybe I need to ask these questions to see exactly what's going on and try to get them to open up a little bit. And if there is that resistance, how to build that rapport and try to, take down some of those barriers and lines of resistance. And so with that, we have a referral process. The referral process is most of the providers will either assign me to the notes within CPRS or send me an email or a summary. And that way, our team are all different. We have Army, Navy, Marines, Air Force, we have Reserve, we have people that have gone through different avenues of recovery. And going through those different avenues of recovery, there may be a peer support specialist that's a better fit than, say, I am, or Mike, or, but we have such a diverse group of people that in that referral process, we can get the veteran to the appropriate peer support that's going to be able to assist them in their recovery process. Next slide, Dr. Davis. So a lot of, peer connections, Q&A, peer support, what is our role in the treatment team? We're there to instill hope and combat the stigma with the VA medical and mental health treatment centers. I don't know about you guys, but I know when I came through, I was like, I'm not going to the VA. I'm not going to see a provider, but having someone there to be able to say, hey, why? Everybody's not bad, let's try a different avenue. So being able to be that role or be in that middle connected piece is one thing that we really strive at, being really there for our veterans. Can peer support be utilized without a veteran being seen by a licensed professional, whether it's our psychologist, psychiatrist? Now that's a double-edged sword. And the reason I say we do that is a yes and no, is because if a veteran is referred to us and they do not have a provider, our role is to get them enrolled in whatever care that they need. So we can't see them on a consecutive basis unless they're either enrolled in a facility, which is getting them through administrative enrollment, or getting them to a provider so that they can get that mental health treatment, because we are not therapists. We are not there to do any kind of psychotherapy. So we can be there as an assistant to you, as your support, as you go through your mental health team, but you can't see us independent. Because if there's anything as far as like active psychosis, we need that LIP. That LIP needs to be involved to be able to track that care and be able to design those plans of care. That is out of our scope of practice. And now that the state of Texas is licensed through the state of Texas, working outside of your scope of practice is really not a good thing to do, because you can lose your license. And I know a lot of peer supports love their jobs like I do. So that's something we need to be able to work with our teams to be able to design. And we can do bridge services. So say if they are with primary care, they're seeing a doctor and they really don't have an appointment for mental health for 3 weeks. Then we can do that bridge connecting to be able to say check-ins, to be able to document so that the providers will see as well. How to get a hold of us? My email is on the bottom. My phone number is at the bottom. Call, text, email is great. Email is always great because we know cell phones don't always work. And then as long as you can email, you can find all of us on email. Michael, myself, Dr. Davis is a great resource. And with that, we can be able to get the veterans into the system. On that note, is there any questions?
Yeah, so there have been a couple of questions that have come through. So one person wants to know, how does one become a peer specialist, and are there peer specialists for spouses?
So for the first question, how to become a peer specialist, there's 2 educational bodies here in the state of Texas that are now over the educational portion for peer support. And that is Wells Education and Via Hope. In that process, you have to have gone through some kind of recovery process, whether it's recovery, mental health, some kind of trauma, or work with someone, or someone in your family has to have some of those concerns that you've worked with personally. It's an application process. Once you do your application process and you're accepted to the program to do the educational piece, you'll have to go through the state of Texas for licensing. That licensing requires a background check, $60, and a whole checklist of things that you have to do. It's really not that intense. It looks scarier than it is. But we do have people through Via Hope that will help you, and Wells will also help you walk through that process. And then they will get you licensed. It takes about anywhere between 30 to 90 days, depends on how backed up they are, as far as getting preliminary licensing and licensing. There is an internship requirement now that once you get your preliminary license, you have to get 240 hours, which has to be under a peer support supervisor or an LIP, and then they sign off, and then you get your full licensing. Peer support for spouses, they are, but a lot of them are through their civilians. Even though we can assist, we're still there. As long as we work for the VA, we're there for the veterans. But there are different entities through military veterans, Peer Support Connection, there's through NAMI. There's other resources that have things for spouses that can offer that peer support as well, because my spouse, when I was in the military, and I was a military spouse as well, the family suffers a lot more than sometimes the veteran does in some aspects. And that was a disconnect at one point, and I think that they're trying to connect that with the peer support piece now. So yes, those providers can also go through that training as well. They just won't be able to work for the VA, but they can work for other entities connected to the VA.
Awesome, thank you.
Any other questions?
Another question is, how many peer specialists are in the peer program?
So right now we have 7, but we're hiring for 5. So we'll have a total of 12 when we complete hiring processes, which is hopefully soon. We'll be fully staffed. And then at that point, we're looking to expand, but we're building our program every year. You know, it was 7 originally, then we got to 9, and then, you know, so now we've redesigned that outlook and that chain. And so hopefully we will be able to get more as our programs grow.
All right, and then the last question here is, how is the VHA peer support program marketed to veterans and providers in both primary care and mental health to consider connection with the peer support providers? How do you promote staff and veteran awareness, and what might prompt the veteran or the professional to consider peer support?
So we have a super staff of providers. Like, I've worked for a couple of VAs, this is the best one ever. But a lot of them through primary care we have champions through all of our primary care clinics, through mental health, and a lot of our providers are aware of our services. So they'll say, hey, they'll ask their veterans, have you ever considered peer support as an option? Do you know anything about peer support? Can I connect you with a peer support specialist? And they'll send a referral, and they'll give them a pamphlet, and they'll give them a lot of information about our services. And then what we do is we get them and we reach out to the veterans and we connect, and we like, hey, my name is Kizzy, I'm a peer support specialist. Do you know anything about our services? And we kind of do a full introduction and meet and greet. Mike is really great when it comes to like benefits and, hey, let me get you to the right people. And, we all have our different strengths and our weaknesses. And so we kind of rely on each other, but our providers know that. And they're like, okay, well, hey, let me get you with Mike. Let me get you to Richard, combat veteran. So our staff is our biggest promoters on our growth within our facility. And so they'll connect them with them. All you have to do is just ask your provider. If any veteran asks their provider, they'll connect them to our services.
Awesome. And I saw that Kylie wrote a comment about the Clubhouse, the Connection Center, being a training base for peer support in Texas. So that's a great resource. Kylie, do you want to add anything else?
No, I just only wanted to add that the training is actually a one-day core training that is about 4 to 6 hours. You have to take the core training first, and then you can do the 5-day training. And at the Connection Center here in San Antonio, we are an online training base or a training entity for people to go ahead and take that 6-day training so that they can move on to the state certification. I just wanted to put that out there.
Perfect.
And also, we'll answer any questions that you have. We are very, very invested in helping people figure out a very confusing situation. So just shoot me an email and I can answer any questions you have.
Awesome.
That's great to know, Kylie, because it gives another option, especially for local people in San Antonio, to be able to take that training. And I know that the Clubhouse also offers our RAP training, and we've gone through them for our RAP training as well, and they're dynamic.
Yeah, Wellness Recovery Action Plan. I saw someone had raised their hand. Lorena, I believe. Are you able to unmute yourself?
I'm so sorry. I was trying to figure out how to block the comments because it's distracting when reading the slides. So I'm so sorry.
No worries. You were just stretching, right?
Yeah.
Okay.
If there's no other questions, I'll turn it back over to Dr. Davis.
Okay, thanks. So I did want to also plug the NAMI groups. Verna, did you want to talk about these, or Mike? Or did you have a separate section?
I'm going to do it on a slide in just a little bit, and Michael will make a comment. Thank you.
Okay, perfect. So just a few more slides here. So we have also the Vet Center. I think Ray is on to talk about the Vet Centers.
Hey, Dr. Davis. I'm Ray from the VA. That's how they call me around here. I know that rhymes, but I know that Verna tried to pronounce my last name a little while ago. It's Ray Calaplastos. And I noticed that everybody that's on this call are not just from San Antonio, and I realized that when I heard someone say they were from Montana. But vet centers are everywhere. We have 300 vet centers across our nation. They're in every state, all 50 states, to include the District of Columbia, Puerto Rico, Guam, America Samoa. And we have 20 vet centers in Texas, 2 here in San Antonio. We're open to see veterans right now. A lot of vet centers are still doing face-to-face. San Antonio was pretty high on the COVID list, so all of our counselors done virtually.
Hey, Ray, you're a little bit muffled. Is there any way you could get closer to a mic or anything?
Can you hear me now? Better?
It's a little better, yeah.
Okay. So vet centers are everywhere, and I hope you heard that. They're in Montana, but we have 20 in Texas and 2 in San Antonio. we're here to provide outreach services and readjustment counseling to the veterans to help them readjust, but also to the family members. I heard a question asked about family members earlier. We provide services to the veteran as long as the veteran is a veteran of an era, and he's eligible, and the whole family is eligible. And the family is pretty loose when it comes to family. Significant other, same-sex marriage, it doesn't matter. It could be your grandparents if they raised you and they know that you have changed since you returned back from. You don't have to be registered with the Department of Veterans Affairs. With that, we also
We lost you, Ray.
Yeah, you've cut out completely.
Can you speak closer to the mic, Ray?
Is that any better?
Yes.
Okay, I changed the USB connection. Hopefully you can hear me now. Better or the same? About the
Much
same?
better. Much better.
Okay, I apologize. It's technology. And that's what our veterans are experiencing, the ones that do not have a great internet connection at home. And we are all virtual right now, so we do see that being an issue. But our vet centers are everywhere. We provide counseling for the whole family, significant others, and I talked about that being, could be your grandparents, whoever raised you, it does not matter. Same-sex marriage. And it does not matter your discharge. We see veterans, as long as you served and you are in a campaign, then you're eligible for counseling services. Most of our vet centers are pretty much based on the same principle, the same rules. As long as you're a veteran, you can be seen there. They have different types of therapy, some music, yoga, other things like that. Chai tea, listen to me. Chai, that kung fu stuff, whatever. Chi?
Tai Chi?
Yes, thank you. So it's pretty loose with the vet centers. They do what they want to do. They help their veterans and they do cookouts and all that. But we have vet centers located in every state. I mentioned earlier, if you didn't hear. Most of our counselors, about 70%, are veterans themselves. So when you talk to a counselor and you mention something that you know that only a veteran would understand, then most likely they will understand it because they've been there and they've done that. The vet-to-vet conversation is very important. Talking about what they've experienced down there. To know that another counselor has been there, they may understand.
We're losing you again.
Okay, I'm sorry, guys. Let's
That's
be
all
my
right.
connection. It's a VA connection.
Yeah. So we have one question for vet centers. Do you have to be post 9/11 or do you see pre 9/11 family as well?
It does not matter what era you served in. It could be from World War II to the present global war on terrorism.
Awesome.
We also serve military sexual trauma. You don't have to be a veteran. And also, if you've had a service member die while on active duty service, we provide bereavement counseling to the whole family.
Yes, absolutely. That was actually another question. What help is available when a veteran dies in negotiating the system? So definitely the services at the vet center could be an option, as well as some of the benefit side for the VA.
That's reservists and National Guard as well.
Awesome.
We have same-day walk-in services for the most part. We're open until 7 p.m. So you come by the vet center, you can call and we can schedule an appointment. But we're here to help and we're open for services. And some of our vet centers are still seeing face-to-face. Our area is a little bit heavy-duty with COVID-19, so we've been virtual. And we're still very busy with the virtual appointments. All our counselors are pretty much booked up all day. Not saying we can't get you in a week or so. So the services are good.
Okay. Thank you. Thank you, Ray.
For the technology.
It's all right. It happens. Okay. So let me just wrap up with a couple other resources here. So of course we have the Veterans Crisis Line, which we always like to plug. It's actually the same as the National Crisis Line, but then if you press 1, you'll be taken to the Veterans Crisis Line. And that is a great resource if you're ever with a veteran who's in crisis. This is a way for you to be able to call with them to get help. And then the last two that I wanted to mention, which goes back to this question of how can family members advocate for services as well. There's 2 resources. So one is the Caregiver Support Program, and this Caregiver Support line is open for caregivers to call and learn more about services and get support. They're actually recently, as of October 1st, really expanding the Caregiver Support Program. So I would encourage you to call and get more information about that. And then I mentioned this earlier in the talk today. We have this Coaching into Care line, which is for friends and family members of a veteran who could benefit from services, but the veteran isn't quite ready or is hesitant or resistant in some way to seek care. And so the friends and family members can call this line and get support and advice and resources in terms of how to encourage that veteran to get services. I think that there was also a question about advocating concerns about veterans care. And so that could also, this line is more for veterans who aren't engaged in care yet. And if you have concerns about a veteran's care, that would likely go more through the patient advocate's office at the VA. I also wanted to touch quickly on a couple other resources or a couple other questions that we had. So one was about mental health first aid. So it's a great question. How can we get more mental health first aid training out to veterans and dependents? So we're working closely with Circle of Arms and there are a couple other local groups, the Ecumenical Center and the Cohen Clinic, who are also mental health first aid trainers. And we're trying to kind of all coordinate on how can we get that training out more to the community, and how can the VA be a part of that as well. I want to say there was one other question. I'm just quickly going through. Okay, so Ray added some information about the Vet Center websites in the chat, so there's lots of good stuff in here. So I would say, Leah, if there's other questions that you have, I'm happy to kind of talk to you individually about the situation and what information you're still needing. Of course, every situation is different. So, and then there was a question about the equivalent service for non-veterans, like Coaching into Care. I don't know if there's a Coaching into Care like resource available for non-veterans. Someone else on the call might know that. I think that's all I have. Let me turn it back over. I appreciate all the questions and all the interaction. Melanie, I'll turn it back over to you.
Well, thank you, everyone that was on the panel today, and we appreciate your time taking us through the services offered through Veterans Health Administration. And we want to, again, congratulate Kizzy on her recent award of Peer Specialist in the Texas region of the VA. So we'll take this opportunity to talk about some brand new resources that are available to the veterans' families. And Verna is going to walk us through that.
Okay, good afternoon, everybody. This was a great general meeting for veterans. NAMI really, our heart is really determined to help the veterans. They so deserve it. Here is a list of all the groups. Since COVID, we've been able to add all these support groups, but I want to point out the veterans group. It meets every Thursday. and I'm going to have Michael say something. He's a facilitator. Him and Miracle volunteer for NAMI to run a veterans group every Thursday, and it's been amazing. And before I mention that, I just want, before I turn it over to Michael, I just want to let everybody know that we are going to start this coming Monday a family support group for veteran families. We're really excited about this. Jacqueline Reed is she's one of the facilitators, and she's a veteran mom and a wife, and she's had a lot of experience. She is also a mental health peer support specialist, and she also teaches rap. So she's going to be excellent for this group, along with Cindy Monroe, who works at Endeavors for the veterans. So they both have a heart and a passion to help families. So I'm excited about that. Michael, would you like to say something about the veterans group that's meeting every week?
Sure, Berta, thank you. Again, good afternoon. Real quick, just the group that we facilitate on Thursdays for the veterans, completely separate from anything that we do at VA. It is tailored around the NAMI recovery model, and we use it to reach out to veterans. We not only have veterans in the group, I mean, while it's tailored for veterans, we have a mother and spouse of veterans. We have veterans from different eras of service, Vietnam, post-Vietnam, Desert Storm, post 9/11. We have just a great dynamic of veterans in that group, and we touch on the hard subjects. And every week is not exactly, a comfortable conversation, but it's definitely a necessary evil in the recovery process. So again, it's a great group outside of what we do with the VA. Again, tailored completely around the NAMI recovery model, and we welcome all veterans to come in and join with us on Thursdays. We start at 6:30, from 6:30 to roughly around 8 o'clock, and we'd love to have you if you're interested. Thank you.
Thank you, Michael. And then on the flyer, or I'll put it in the chat box. Oh, here we go. On the flyer, there's my email address and telephone number, and just reach out to me and I can get you registered. So thank you very much. I'll turn it over to Mel.
So we've added Verna's contact information to the chat, and you can contact her whether you're interested in the veterans group or the family support group for veteran families. Exciting to hear about this new resource. So as you all know, we had our NAMI Walks event this month, and we're going to have Terry Mabrito talk to us about the success that we have so far.
Hi, everyone. So glad to see this large group of people to hear this great presentation. And Dr. Davis, Michael, Kizzy, we're so grateful for this wealth of knowledge and resources that you've provided. And it's that passion that we all have around mental health for all, right? That really just, is so evident in what you all just presented, but also in our walk this past Saturday.
Listening with that Tesla.
So we had a really great, great Saturday. Our first ever, of course, virtual walk. And everybody, there we go. We had to get somebody muted there. So we had over 50 teams. We had over 270 registrations or participants on the fundraising side. We had great sponsorship support. And so we reached 90% of our 65K goal, which is really, really phenomenal. And I'm telling you, it was so fun. To see, even as you see on the slide here, just the happy faces the creativity. And you can always kind of go back, check out our Facebook and Instagram, and it was really so much fun. I heard, I didn't see this one myself, but I heard someone was riding a unicycle. I think we had horseback riders. So it was truly a unique event. We really miss seeing all of you face to face, whether it's, you know, in our general meetings like today, or in our larger events. But we're so proud of our team, and not only the teams that worked hard to fundraise for us, but also our team in terms of our staff, and our board, and an amazing group of volunteers that helped CJ work through all of this and really make it a success. So I hope you enjoyed it. I hope you had fun, and just know that we're going to figure out how we're going to do it next year as soon as we can. And we do hope it's face to face. We really do miss seeing you all. Let's see, I think next slide, maybe, Mel. I'm not sure. I know I can't control the slides. There we go. So we also wanted to share with you all that typically, you know, in November, we have the NAMI Texas annual conference. And unfortunately, of course, we're not able to do that face-to-face this year. So they're offering some webinars, and I'll talk about the other piece of what is going to be offered for the conference. But we're so excited that tomorrow we will have a wonderful webinar with our own local experts, dignitaries and experts. So Commissioner Rodriguez will be speaking, as well as Gilbert Gonzalez, who's the director of County Department of Criminal Justice Policy and Planning. And you do need to register, so please do that. And this is a part of how we are offering out information and presentations in lieu of the national, the state conference. And of course, this presentation will be about expanding our treatment capacity, and it will also talk. So you don't want to miss this. This is going to be really good. So please go ahead and register. You can still do that. And let's see, next slide. So back to the Texas conference. Again, we're sad that we can't be in person, but we are happy that on the 7th at 10 a.m. Central Time, that's our time, we will have the annual Texas annual board meeting, or rather business meeting. And we are really excited because one of our own, Carmen Ortiz, is going to be honored as the Jackie Shannon Enduring Volunteer for the year. And now we cannot leave out Pete. Even though you can only nominate a person, we know that Carmen and Pete are just the most faithful volunteers and leaders, and we're just so happy that we're going to be able to honor them both, really. And you can see the other awards there. We have some other, familiar faces that we know. Certainly Angela Horner, who some of you have probably received training from, is also being honored. Also, you'll see Adrian Kennedy, who's been the president of NAMI National, and is of course been very, very founding force in Austin as well. So we're going to have a great program, and we hope you will that you will attend. Okay, next slide, Mel. So we're also really excited. October 10th was really, truly was World Mental Health Day and a National Day of Hope for NAMI. And in honor of that, NAMI National has worked really hard to bring forth a new effort. So NAMI Frontline Wellness is a brand new effort launched on the 10th. And it's resources for our frontline workers. We all know that, you know, the pandemic has really taken a toll on physical health and mental health. And for many whose jobs are, you know, really already demanding, you know, and stressful, those that are in public safety, and particularly our healthcare professionals, that stress level, I can't even, you know, really, I can't imagine it. And so we're very happy that NAMI National has been able to bring forth this initiative. It had a lot of collaboration to bring it to a launch point. And it will include resources around information to identify the signs of a potential mental health emergency. It'll help people to deal with just their stress load in those frontline positions. It's also and support for family members of our frontline workers. So we just invite you to check it out and to share out this new resource. Next slide. I'm not sure if that's the last slide or not. There we go.
Yep, so now we're going to turn it over to Carol.
I don't know if Carol's going to speak.
Yep.
Yes, perfect.
Okay. My goodness, we have been afforded so much wonderful information today. Again, thanks to everyone for being here and all of our wonderful presenters today. You were just a wealth of information. I'd like to share with you information about a class that NAMI San Antonio is going to offer a little bit later this year, and it's called NAMI Smarts for Advocacy. We can all make a difference when we begin to advocate. And grassroots advocacy is all about using your voice to influence policymakers and to make a difference. And you can really turn your passion and your lived experience into a positive voice for mental health with the NAMI Smarts for Advocacy training. It's going to enhance your advocacy skills and help you shape a powerful and personal story that will move policymakers. Again, the title of the course is NAMI Smarts for Advocacy. Right now, we have 3 dates planned to share with you. That's November 21st, December 12th, and January 3rd. All of these dates fall on a Saturday. Right now, we're planning to begin the training about 11 in the morning, and it will last for about 3 hours. So from 11 to 2. And of course, they'll all take place online. And in order to register, the information is here for you. You would email me, Carol Hollins, and please make sure that you include your name, your address, your zip code, and your phone number in your message, and I will contact you and we'll coordinate which session you'd like to attend. And you're welcome to register for all 3. Okay, but NAMI Smarts really does give you very important step-by-step tools, and you'll have hands-on practice that help you to feel very confident and ready to make a difference advocating for our loved ones, which is so very necessary. And Mel, if you don't mind, I would like to move forward, also share rather, information on, just a minute, I'm sorry guys. Okay, needed to turn that noise off. I noticed that there were a couple of questions about help being available for other than veterans. NAMI San Antonio also offers an education course called Peer to Peer. And we'd like to invite you to be a part of those classes as well. They are 8-session courses, and they are being provided for individuals that actually have a mental health condition. They're free. The courses they're confidential once you're in there. We meet for 2 hours every week for 8 weeks. And another really great thing about it is that these courses are led by peers that have mental health conditions as well. And they are in recovery and serve as a great resource for information on mental health and recovery. So I encourage you to do that too. And the registration process would be the same. The email information that's shown there on the NAMI Smarts slide is the same if you'd like to sign up for peer-to-peer. And one last one, I noticed in the chat box, someone questioned Homefront availability. Right now, I don't have actual dates set up for the Homefront course just yet, but I am in the process of completing the education course myself. In fact, just before this session today, I was in my second class. And the plan is, when I finish that, we have at least 3 of us that are going to be trained as leaders to teach the Homefront course, and we plan to begin offering it in 2021. So you will receive more information at a later date. Thank you.
All right. So just to kind of wrap things up, we've got lots of resources available for both veteran families, as well as the community at large. A lot of the information that we've talked about today is shared with you in your chat box. So check out that chat box for any upcoming training. And of course, refer to NAMI-SAT.org. If you have any questions, you can find out more about resources as well as support on our website. So just as a reminder, our NAMI general meeting is held on the 2nd Tuesday of every month, and November will be no exception. However, this is our annual meeting, and we'll be given an annual report provided to us by the board. They have lots of information to share about 2020 accomplishments with NAMI, as well as future endeavors. We'll also be hosting board elections, and voting will be allowed by standing members as of July 2020. So stay tuned for those notifications. And then, as always, we cannot close without mentioning our NAMI membership. Be sure to check out our website at NAMI.org, about-NAMI, to join if you're interested in placing membership. Thank you so much for your